Hi, welcome to this topic's first module. Today, we're gonna be discussing what is cardiac arrest and how does it happen. But first, let's try to understand the importance. Today, cardiac arrest is the most common disease in the west side of the world, and many patients still don't know how to manage it, how to understand it, and how to define it. But to start with, let's try to understand it and define it then. What is the cardiac arrest or the heart attack? Cardiac arrest or the heart attack is basically the damage that the heart suffers when the blood supply is cut off. Therefore, the muscle of which the heart is also made of, but the cells that it also is constituted of, is gonna wind down, and this is gonna cause a problem with the supply of oxygen and nutrients that the heart needs to survive. As such, many of the symptoms that you're gonna feel during this acute moment or severe moment are gonna be the pressure on the chest, the severe chest pain, the radiating arm pain, anxiety, or the lack of breath. Those are some of the most common symptoms, but they can vary from person to person. Also, it's good to understand that the heart damage is the equivalent of something such as this flower. Let's imagine that this flower is on a vase. A hose is going to be needed to be able to water it in order to receive water, the oxygen, and also part of the nutrients that it needs. Let's imagine that, for example, that hose that we have is going to suffer some damage. Either a hole opens up or it's clogged. Something similar happens in our veins or arteries, if you know that name. But arteries are basically one of the blood vessels that carries out the blood to the heart, but also to the rest of our body. And if damaged, it can either be incapacitated or have troubles supplying that blood to the heart, or not being able at all. And comparing to the hose once again, the water is not going to be able to reach the flower, which it needs to be healthy. As such, the flower is starting to wind down. And again, something similar happens in our heart. The blood supply is cut off as the water is cut off to the flower, and our heart is going to suffer some damage. The damage is going to be carried out by the patient throughout its life. And adding to this, the patient is going to be needing management from the healthcare professionals. The team is going to help the patient manage symptoms such as the pain, but also the anxiety that comes from it. Adding to this, some lifestyle factors such as smoking or sedentary lifestyle, but also the drinking or the diet the patient has a big influence. As we may know that cholesterol, the bad cholesterol, which is also called LDL cholesterol, but let's call it bad cholesterol, can also build up and create a plaque. That plaque is the material that obstructs our blood vessels, so our arteries, that is going to forbid or going to stop the blood from reaching the heart. It's good to understand as well that the heart has ways to counter this in the management of itself. So it's going to create scar tissue, but it's also going to strengthen the other parts that are still healthy. And if you have the procedure of stent, which is kind of like a metal sleeve that is going to cover your artery in order to keep the blood still running. Something can similarly happen at a hose, where you can put a cover up, which is going to help the blood or the water still go to the flower, the same way is going to happen at your heart. And this can once again revive some of the material at your heart, so the muscles or the cells that are going to keep it strong and keep it running healthy. Thank you for today's video. I hope it was clear, and let me know if you have any feedbacks for the next video. Thank you. See you.